Okay, I'm live.
Hi. Hello. Hello, Rupa. Hello. Can you hear me?
Hello, ma'am. Am I audible?
Yeah, you are audible.
Okay, yes, ma'am.
So my screen visible to you?
Yes, ma'am. It is visible perfectly.
What can you see? Slides?
Yes,
Uh,
ma'am. I can see the slides.
Something else also? Side notes or something?
Yes. Like the next slide, chapter 3, breastfeeding introduction.
Okay. So you are seeing the next slide also, right? Okay. Thank you.
Hello, ma'am. Am I audible to you?
Yes, yes, you're audible.
Ma'am, when we are supposed to start because it is just 2 minutes to go, so should we wait for a few more minutes?
Yeah, you can 5 minutes.
Okay, ma'am. Just tell me when to start so that I can start forward.
Let some participants join. It's only two participants. I'm seeing only two participants.
Actually, ma'am, in this room, the delegates will not join. They have a different platform.
So how many have joined?
Just allow me some time to check that.
Okay.
Ma'am, as of now, 10 participants have joined, and the number is, ma'am, fluctuating.
Okay. So you can announce. Okay. Let's wait for 2, 3 more minutes.
Okay, ma'am. Ma'am, right now the number is 17.
I think we can start now. Should we?
So, ma'am, it is as per you.
Okay. I'm ready.
Ma'am, the number is increasing. Now it is 25.
So let's start.
Okay, ma'am, am I visible to you?
Yes, you are.
Okay, so with all your permission, ma'am, I'm starting the session. And ma'am, another thing, may I hand over to you? Because
Yeah.
no one else is here, so I will hand over to you, okay, ma'am?
There are no one else, Dr.
No,
Pratima.
ma'am. No, ma'am. No, ma'am. Till now, it's only you and me. So what should I do, ma'am?
Let me just ask that should we start?
Okay, ma'am. So I'm waiting for some time.
Okay. Yeah, she's saying that let's start. It's almost 25 have joined now. Yeah, so we can start.
Ma'am, am I audible now? Yeah,
Yes,
I
you're
hope. Just allow me to check, ma'am. 25, yes, ma'am. So should we start?
yes.
Okay, then I will hand over to you, ma'am. Good evening and a warm welcome to all the dignitaries present here. Myself, Rupsha from ClearNet, assigned as assistant to ensure a seamless experience. ClearNet stands as India's most relied upon digital platform, offering a multitude of nursing services exclusively for doctors. It is with great pride that ClearNet is a digital partner of this event organized by National Neonatology Forum. And the topic of today's session is NNF Shine Week 2 North Zone. So let's begin today's session, for which I would like to give the handover to Dr. Mamta ma'am. Over to you, ma'am. Kindly proceed with your talk.
Thank you so much. So, good evening, everyone, and welcome to our NNF Shine program, the second module, a very, very important topic about the breastfeeding. So, all the students must imbibe this during their first year, that how important it is to tell mothers about the breastfeeding. So, we all know that the milk is the optimal nutrition for the newborn baby, and it is the best milk. But still, we know that exclusive breastfeeding is like it can prevent the under 5 mortality to 13%, because still the diarrhea and dehydration and upper respiratory tract infection is the most important cause of death in our country. So initiation of breastfeeding within 1 hour of birth and exclusive breastfeeding till 6 months of the age, it reduces 22% of all neonatal deaths. So it is very important for all of us. Being a pediatrician, it is a responsibility that we should start the counseling of the mother since beginning from the antenatal period to how breastfeeding is important for the baby. So recently a program was launched by the government of India, that is the Mother's Absolute Affection program, and it is to create enabling environment promoting and supporting breastfeeding in India. So but still there are a lot of challenges lying down in this, because we know as per the NFHS survey 4 in 2015 and 16, only 42% ladies, mothers were breastfeeding within 1 hour of birth to their babies, and only 55% children under 6 months of age were exclusively breastfed. So still we see that more than 40% of the babies are not getting breastfeeding till 6 months of age. So with this module, the learning objectives for us is that enumerate advantages of breastfeeding, helps mothers with correct technique of breastfeeding, identify factors enhancing lactation, identify difficulties associated with breastfeeding and their solutions, help mothers in expression of breastfeeding. So when we talk about, we like usually we see that what is there that we should tell about the mother about the breastfeeding, they will do it automatically. But in most of the cases, we know that most of the mothers, especially the primary gravida mother, they don't know about that, how to do the positioning, attachment, and there are so many other factors. Even they don't know the advantages of the breastfeeding. So it is very much our responsibility to tell them about these things, because we know that the breast milk is important not only for the baby, but it is for the mother, to the family, and the society. Everywhere you see that it is very important. So if we look about the breast advantages of breastfeeding to the baby, so the first important is it gives the optimum growth, nutrition, and development to the neonate. So it covers the all the three parts. Improves the IQ of the baby, it improves the nutritional level of the baby, and overall growth of the baby. We know that breast milk has lot of immunological factors, lot of anti-infective factors, and we call it as the first immunization of the newborn baby. It is easily available at appropriate temperature, because most of the time the babies who are on top milk, there are a lot of hassles. The mother has to carry the milk with us, and the boiled boiled katoris or the boiled, there are so many things the mother need to carry, and which creates a lot of unhygienic practices also. So it is like a very aseptic, easily available, and at appropriate temperature. And we know that it is made for that baby, so it is easily digested by allergy. It protects against allergies, including the eczema, asthma, and other. It causes a lot of emotional bonding between the mother and the baby. And as I already said, that it increases the IQ, which has been proven in several studies. Less chances of hypertension, diabetes, coronary heart diseases in the later life in the babies are there. So we know that it is very, very important to give breastfeeding to the baby. If we see breastfeeding advantages to mothers, because if the mother breastfeed their babies after birth, that it helps in the involution of uterus and reduces chances of postpartum hemorrhages and even the psychosis also. Exclusive breastfeeding delays next pregnancy, inexpensive method of contraception for mothers. It releases some protective factors, and it lowers the risk of breast and ovarian cancers to the mothers who are continuously breastfeeding their children. And it definitely reduces the workload of the mother, as I said. If we see for the family, so what happens if the baby is on the exclusive breastfeeding? So the recurrent diarrhea and other problems which are there with the baby, upper respiratory tract infections and many other things are less. So there is less hospitalization to the baby. It decreases the mortality rate, morbidity rate, and infections in the baby. So unnecessary hospital loads also decreases. It improves the contraception and the family planning, and it is more economical than artificial or the formula feeds. Because if you see the cost of the formula feed, it is very, very costly. So for a lower middle income country, and the most of the population are like from the LMIC are like they can't afford these type of formula feeds. So we should avoid all these things. So the first thing which comes about is what is colostrum. So you all know that colostrum is the first milk which has been produced by the women in first few days after the deliveries, especially first 48 hours to 72 hours. It is dark yellow color, thick, but is in less quantity. But the most important thing is it has lot of anti-infective proteins, antibodies, and white blood cells. So it is the colostrum is the first immunization to the baby because of its anti-infective proteins and anti-infective first dose of it. So colostrum has mild purgative effect also. So it helps in clearing the meconium from gut and helps to prevent hyperbilirubinemia in the neonates. So once the baby starts passing the motion, you all know that it will decreases the hyperbilirubinemia in the baby also. So the colostrum is the first thing which is very, very important. So there are few things like we all know that the milk has a lot of immunological factors, but the few points I again want to tell you about the human milk is that the human milk contains live activated macrophages, neutrophils, and lymphocytes at high levels, especially first few days of lactation. So it is very important to establish or initiate breastfeeding as early as possible within half an hour of birth, and give initial 2 to 3 days must give. So most of the time after cesarean, the mothers are in pain and they don't want to start the breast milk, but here we need to counsel them again and again to start and give the colostrum. It contains protective cells which remain active in the neonatal intestine for 60 hours. So once the baby gets the mother's milk, at least for next 60 hours, the baby's intestine got some protection. Colostrum especially contains a lot of lactoferrin, which is antiviral, bactericidal, and anti-inflammatory in nature. And as I said, it protects the mother from the breast and the ovarian cancer. It has also been seen that it results in the reduction of childhood leukemia due to Hamlet and aggressive of several molecules of alpha-lactalbumin, which attacks tumor cells. It also increases the size of thymus. So we know that thymus is very, very important for the immunomodulation in a person's life. So if its size even relates to the number of breastfeeds per day. So it is very important that in the all factors we have seen that in how for the immunological reasons, the breast milk is very, very important. So what are the recommendations for the breastfeeding practices? Initiate breastfeeding soon after birth, within half to 1 hour. So when the baby is born, the baby has to be born over the mother's abdomen. Clean the baby there. And if the baby is crying and active, please start breastfeeding then and there over the labor room table. Do not introduce any prelactal feeds. Any prelactal feeds means no ghee, good tea, or honey or milk, top milk, any other things. For the initial 6 months, only give exclusive breastfeeding, and both during day and night, because night feeds are as important as day feeds, at least 8 times or more per as per the demand of the feed. Allow baby to feed at one breast till she stops sucking and releases the breast. Then offer the other breast. This is very, very important because there are two types of milk which comes. It's the hind milk and the fore milk. So fore milk is usually very watery and contains a lot of immunoglobulins uh, and the protective factors, but it will not help in gaining of the weight. So if you will give the hind milk, it has a lot of fat and is very much required for the weight gain of the baby. So always tell mother that she has to feed the baby from the one breast completely and then only give it from the next breast. Then adequacy, how will you check for the adequacy? If the baby is passing enough number of urine, like 6 to 8 times per day, is adequate, having adequate weight gain of 20 to 30 grams per day in first 3 to 4 months after regaining the initial birth weight. Initial complementary feed must start after 6 months of age, but continue breastfeeding till 2 years of age. So these are the all very important points which we need to tell our mother. Now we'll come about the anatomy of breast, how breast is important, what are the tissues of the breast, what are the reflexes, which. So breast tissue has the glandular tissue and the support tissue, which are usually filled. So when you see the anatomy of the breast, so the breast has a lot of alveolar cells, and these alveolar cells, it has the during the pregnancy with the reflexes of the prolactin and this, it oxytocin, it increases in numbers with have lot of milk secreting cells and muscle cells. So it goes into the larger ducts and then it comes under the areola where the milk is gets stored. So when you see this anatomy is very, very important for many things, like how the reflexes works, how the milk expression when mother is doing, how she'll do the milk expression. So when we see that the baby is born and baby is ready for taking the breast milk or not. So how we need to see, there are 3 reflexes which we need to see in a baby. So in the term babies, the rooting, sucking and swallowing reflexes are there and they are coordinated reflexes. So after 37 weeks and onwards, these 3 reflexes are there in the baby if the baby is not having asphyxia, and they are usually the coordinated reflexes. The sucking, swallowing and rooting is present. But if the baby is preterm, 34-weeker, 33-weeker or sometimes, so we need to see that how is the rooting reflex, how is the sucking reflex, and sucking, swallowing, rooting is coordinated or not coordinated with the respiration. So whenever the baby touches mother touches the cheek of the baby takes the root her mouth towards the nipple and takes the nipple in the mouth and try to suck that nipple and swallow. So that is proper rooting, sucking and swallowing reflex. So always see for the activeness of the baby and see for the rooting reflex and then see that the sucking is there or not. Then we come to the physiology of the breastfeeding. So there are 2 reflexes which are very, very important when we talk about this. The first is the prolactin reflex. Prolactin reflex is helpful for the milk production. So prolactin is secreted by the anterior pituitary gland. Its secretion increases at night by suckling of baby on nipple when breast is empty. And prolactin suppresses the ovulations and prevents the conception. So that's why I said you that night feeds are very, very important, because if the baby feeds during the night, then only the the secretion of the prolactin increases and because prolactin is mainly the secretory hormone. It helps in the secretion of the breast milk. So it is very, very important. So whenever the baby sucks, you see in this diagram, whenever the baby sucks, the sensation sensory impulses goes from the nipple to the anterior pituitary, and from their anterior pituitary, the prolactin releases and comes into the night. But the most important thing is that the night feeds are very, very important. And the other thing is that it helps in suppression of the ovulation. So it acts as a contraceptive also. So how prolactin feeds the enhancing factors is that emptying of the breast, the complete emptying leads to the sensation, sensory reflexes going to the anterior pituitary, frequent suckling of the breast, expression of the milk, and the night feeds. These all factors, it enhances the prolactin or milk secretion reflexes. What is hindering factors? The bottle feeding or incorrect positioning or painful breast. If mother is having pain or the baby is having confusion, bottle feeding has been started, then it will hinder the prolactin reflex or decreases the prolactin secretion and the secretion of the breast milk. So the prolactin reflex is one reflex which is very, very helpful, important. Then comes the oxytocin reflex. So oxytocin reflex is for the milk ejection or output. Oxytocin is secreted by posterior pituitary and secreted by when the baby suckles the breast. Smell, sound, touch of the baby when mother is calm, relaxed, and stress free with back massage. So this is very, very important because most of the time mother usually they say that there is no milk. I have not started milk during the initial days, or it was post cesarean, baby was in an ICU, or there are so many reasons that baby was not with me and it was not. But still you can say that whenever baby comes to you or whenever you are near to the baby, if that love comes when the baby is there, so with that psychological effect of the mother, like when she sees the baby, smells the baby, sound and touch of the baby, and especially when she's calm and relaxed, so it increases the oxytocin reflex and it increases the milk output. So very important to give a good counseling of mother and tell her the factors which increases the milk output, and tell her to be relaxed that this will definitely come. There is no pathological reason that the God has given. It's such a natural phenomena. Then why the milk will not come? So it's always our counseling which makes mothers very calm, quiet, and when she comes inside the NICU or when she sees the baby, touch the baby, smells the baby, and try to put the baby on breast, the oxytocin releases and it gives lot of milk to the baby. So there is no as factor which decrease, but there should not be any worry, stress, pain, or doubt to the mother. So mother should be in a calm, composed, and relaxed, stress-free mood when she is breastfeeding the baby. Then there are two more very, very important things whenever the mother is feeding the baby. Especially we see in the primary gravida mothers because they don't know how to hold the baby, how to take them for the breastfeeding. So always whenever we are trying to start on the breastfeeding, we should see that is the positioning is correct or not. So for the correct positioning, we need to see four things. Is baby well supported? So you see the hand of the mother. So mother hand is completely supporting the baby in the way that head, neck, body of the baby is in the same plane. So we should always see that how mother is holding the baby and what is the position of the baby. And entire body of baby is facing the mother. It's only not the face which is facing towards the mother or the breast. Its whole body should be facing the mother, and baby's abdomen should be touching the mother's abdomen. So these are four correct position which always you must see whenever the mother is feeding and you are going to the postnatal ward or anywhere in the round. Okay. So these are called the four positions or the correct positioning. Now comes the correct attachments. This is again very, very important that baby should be attached correctly when mother is feeding. So the first thing which we need to see is that baby's mouth should be wide open. The whole areola, the black part of the areola should be in the baby's mouth. It is not only the nipple. If it is only the nipple, the nipple will get sore or the cut nipples will occur and the mother is having a lot of pain, and then pain again decreases the breastfeeding, as we see in the prolactin and the oxytocin reflex. So we need to see the correct attachment. That baby's mouth should be wide open. The lower lip should be turned outward. When the mouth is wide open and the whole black areola is in the mouth of the baby, the lower lip will be outward. Then baby's chin touches the mother's breast. And majority of areola, I have already said. So there are 4 points of the correct attachment. So always check that is the position is correct or not, or is the attachment is right or not. But still, there are so many problems occur during the breastfeeding. So the few of the problems we can prevent if we do the proper education of the mother, how to feed the baby, what is the proper positioning, attachment, or some problems in the antenatal period. If we check them continuously, if the our gynae friends, they'll see, then it will not occur. The first important problem is inverted or flat nipples. So if the nipples are flat or inverted, you see in these figures, then it is very difficult for the baby to have the proper attachment. So for that, we need to see that if it is detected in the antenatal period, it's best that we can start telling mother about that and how to take out the nipples regularly, do the massage of the nipples so that it will no more flat when the baby is born. Or uh, if it is there, inverted flat nipples, then there are some treatments available, which we will tell you later. The second is sore nipple. It is usually, I told you already that if the attachment is not correct, if the baby is suckling only the nipples and not entire areola, then there will be cuts in the nipple area and it will cause the sore nipples. And again, if the frequent washing of breast will be done with the soap, then it will also cause the sore nipple. And if some infection is there over the breasts, then nipples, then it will cause the sore nipple. So there are three mainly things. The most important thing is the incorrect attachment. So that's why it is very, very important that it is to see one's mother, how she is breastfeeding her child, and tell her about the correct positioning and attachment. Third is breast engorgement. So what happened usually during first 2 days, or sometimes in the last trimester, last few days before delivery, the milk starts secreting and start filling in the ducts. And when mother starts feeding the baby, so because the milk is already too much in the breast and it's filled in the ducts, it will not come out, and it will, like, it's the engorgement or the heavy, very tight breast, so baby will not be able to suckle those breasts, and mother will feel that milk is not coming, but milk is already there in the alveoli, and it accumulates and it causes the breast to swell and hard and tender. So this is also leading to, mainly because of the, either we have delayed the feeding or poor positioning of the baby. So breast engorgement is very, very common, and being like mother usually not able to identify that it is breast engorgement. She feels that the milk is not coming. That's why she stops feeding the baby, or the baby is not taking, or because of some other reason. But we need to take care that, just with the permission of the baby, mother, ask her and check her that can we see your breast, and when you feel that the breasts are hard or engorged, then we need to tell her about the treatment. So the fourth point is breast abscess. So sometimes when the engorged breasts are there, or infected or cracked nipples are there, or blocked ducts or mastitis are there, so if all these things lead to delay in treatment, it causes infected breast segment to form the breast abscess. Mother may have fever, pain, and raised blood counts. So that also we need to see by examining the mother. Another very common problem, which usually we say, often mothers only say that my milk was not enough, so I need to start on the top milk. But it's not so. We need to really reassure her and tell her that why it is not enough. It is enough because your baby is gaining good weight or baby is sleeping well after taking feeds. If you tell good, do the good counseling here and reassure her that your milk is enough, then she'll like really stop giving the top milk. Or because it's a very common, most of the mothers, they usually complain, no, my milk is not enough, it's not that much, that's why I need to give the top milk. But it is not so. If she continuously take it out, especially during the night time, if she feeds her baby and touch the baby and have a good psychological thinking that yes, I have to feed my baby, it starts coming. So there is no reason that why milk is not enough. There are, like, it's the poor oxytocin reflex or breast engorgement or mastitis or poor attachment. They all can lead to the poor problems of the not enough milk. So the first thing which is like which we have seen is the I want to tell you about the syringing technique for the our nipples if they are not formed well. So the first thing is what you will take a syringe of around 5 ml or 10 ml. 10 ml is better than the 5 ml. So cut the front head part of the syringe. So cut along this line with the blade, then remove the plunger from its original place of the front area and put it from the insert it from the cut end back, and then from the end which from where you have removed the plunger, you put that area into the mother's milk, so it will create a vacuum. And just tell mother to gently pull the plunger. So if she will do it 5 to 6 times once, and at least 8 to 10 times in the day, then her nipples will be all right. So it is very important to give this syringe to the mothers, and she can do it manually also. She can take out manually, repeatedly her nipples out, do the gentle movement of the nipples out, and then it will happen. Then in the low birth weight babies, because I already told you that there is a problem in the sucking, swallowing, breathing coordination in the preterms and the low birth weight, especially less than 35 weeks. After 36 or 37 weeks, there is good coordination between the rooting, sucking, and swallowing with the respiration. So we need to see that how we can establish breastfeeding in these preterm and low birth weight. So, and we also know that the preterm milk is unique for that mother's milk is unique for that baby. So it has a higher amount of protein, calories, and protective substances. And we need to start milk expression within 6 hours of delivery. Otherwise, breast engorgement will occur, and there were many other problems will happen in the mother. So it is very important, even if the baby is preterm baby or baby is not accepting feeds or baby is an SNCU or an ICU, but tell mother to express milk every too early, or go to the lactation management unit and express it and store it there, so that whenever the baby is allowed to give milk, she'll be ready with the enough milk for the baby, and she like the initial 2-3 days milk colostrum will be there for the baby. So nowadays, if the preterm babies, they are stable, they are hemodynamically stable, so we start feeds as early as on day 1 of life on full feeds only. So usually the sick baby, hemodynamically unstable baby, we don't start feeds. Otherwise 28-29 weeker baby, stable baby, start on the breast milk with the express breast milk with OGs or katori as per the baby's age and gestational age and the weight, but give feeds as early as possible. If you are not giving the feed, then only tell mother to express her milk every too early, at least 8 to 10 times per day. And encourage mother to visit, touch, and care for her baby as often as possible. She should be allowed to go inside the SNCU. She should be allowed to stand there, touch her baby, or allowed to do KMC there, sit there and do the KMC. And do the non-nutritive sucking. That is also very important, because after emptying the breast, just tell mother to do some non-nutritive sucking, because this NNS is very important for the like for the baby. especially for mother also, for baby also. And while doing after KMC, while doing NNS, the mother's milk will output will improve, and the baby's oromotor reflexes will start developing, and baby will develop a better sucking reflex, and coordinated rooting sucking will develop. And after, baby will secrete lot of enzymes that will help in the digestion of the baby. So NNS is very, very important. So every time, whenever mother is going, tell mother to do NNS if baby is preterm but stable. Then comes to the expression and the storage of the breast milk. So as I said, that if the baby is premature, low birth weight, sick, or cannot be directly breastfed, or mother is working also, like the 3 months or after 4 months, if mother has to go for work, she should be allowed to, you should explain her that you will be take out your breast milk in different containers and label them and keep them in refrigerator. So EBN can be kept at room temperature for 6 to 8 hours, and for refrigerator for 24 hours. So even a working mother, if she can store her milk in different containers and label them with the date and time and keep them in refrigerator, so the first in will come out, the first out. So she can give at least for 4 to 6 feeds when she is not there with breast milk only. So expression is very, very important, and will allow, tell mother to express the breast milk. So these are the 10 steps to successful breastfeeding. So first is the hospital policies. So hospital supports mother to breastfeed. That is very, very important. As early as within half an hour, even if it is mother is cesarean, baby is born after cesarean section, or if the baby should be kept over the mother's abdomen and breastfeeding is started then and there only. And if the baby is preterm, then also the express breast milk will be given to the baby as early as possible. Then staff competency is very important. So if the lactation counselors are there, is okay. But otherwise, it's our responsibility, doctors and nurses working in that area, to counsel mother and father every time when they are visiting to the mother, talk about the breastfeeding, importance of the breastfeeding, how to breastfeed their mother. And this is very, very then comes the antenatal care. So our obstetric friends, they should must see the nipples of the baby. They should talk about the breastfeeding. The breastfeeding counseling should start in the antenatal period, and how to prepare mother in to feed their baby from the antenatal period. Care right after birth. So hospital supports mothers to breastfeed by encouraging skin to skin contact just after birth, and helping mother to put their baby to the breast right away. As I said, within half an hour. Then after that also, mother needs support. So like checking the positioning, attachment, sucking, that baby is sucking properly or not. Then giving practical breastfeeding support, and helping mothers with common breastfeeding problems. So sometimes she is having sore nipple or engorgement of breast. Then we need to be there with mother, tell her how to do the massage, how to express the breast milk, and how to give the even express milk to the baby. Then the supplementing. So for 6 months, it is enough to give the breast milk only, but uh, so giving only breast milk unless there are medical reasons. So it's until unless it is not contraindicated, the breast milk is only thing which we tell mother to give. And prioritizing the donor human milk. If you in your vicinity, if donor human milk is bank is available, then we can tell parents to get the human milk from the baby, from for the baby from there, if the mother's milk is not available, or helping mothers who want to formula feed to do to safety. So like in cases of HIV, if the mother is HIV positive, so normally in our country, we don't tell them to give, we need to give the counsel them, either the baby should be on the complete top feeding, or baby should be on complete breastfeeding. So there should not be any mixed feeding. The choice will be given to parents said what they want, but if they want to continue with breastfeeding, it is well and good. But in case they want to go for the formula feeds, then we need to support her for the formula feeds, but there should not be any mixing of the breast milk. So it's very important to counsel for every condition for this. So rooming in is another very important thing which supports mothers to breastfeed. So letting mothers and babies stay together day and night. So making sure that mothers of sick babies can stay near their baby. So previously, many of the hospitals, SNCs, they don't allow the mothers to come in or see their baby. But now with the family-centered care, we know that from the first day of the life, we allow mother to come inside the nursery. We allow them to touch their baby, to stand there and to express their milk and give their milk to the baby. Then responsive feeding. So helping mothers know when their baby is hungry, non-limiting breastfeeding times. So it should be like on-demand feeding. So whenever baby wants, the baby mother should feed that. It is not only too early I'll feed the baby or 3 early baby will be fed. It is as and when baby wants, the feed should be given. Should not start on any bottles, teats, and pacifiers because they create a lot of confusion between the nipples and the other nipples like bottle nipples and this. So counsel mothers on the use and risk of feeding bottles, teats, and pacifiers because we know that bottle feeding is the most important cause for the diarrhea and dehydration, the asepsis you can't maintain, and the poor hygiene that lead to a lot of problems. So mother should be advised not to give these pacifiers. And the last is discharge counseling. So referring mothers to community resources for breastfeeding support. Like there are ASHA workers and other counselors and the workers in the community who routinely visits them and talk to them, see them and support their breastfeeding services. So very important, like usually in the postnatal ward, baby get discharged, mother and baby get discharged on within 24 or 48 hours. So after that, the ASHA workers and the ANM should visit them and see that how breastfeeding is established and other things also like immunization and other factors, but it is very important. So these are 10 steps to successful breastfeeding, which WHO and UNICEF has given. So comply fully with the International Code of Marketing of Breast Milk Substitutes and relevant World Health Assembly solution. So IMS Act is very, very important. Everyone must know IMS Act. Out of that IMS Act, we can't write any formula feed to any baby. So please don't ever write any formula feeds to the baby, to the mothers, because it's a very strong act. And if you advertise any IMS Act in your clinics or in your hospitals, that is going to create a lot of problem for. Have a written infant feeding policy that is routinely communicated to staff and parents. Establish ongoing monitoring and data management systems. Ensure that staff have sufficient knowledge, competence, skills to support breastfeeding. So do take the staff classes routinely regarding the breastfeeding. They should be trained and retrained regarding that. Discuss the importance and management of breastfeeding with pregnant women and their families. This is very, very important, as I am repeatedly saying that counseling of the mothers since antenatal period is very, very important. Immediate and uninterrupted skin-to-skin contact support mother to initiate breastfeeding. So KMC is one skin-to-skin contact just after birth and KMC then after, which forms a strong bond between the mother and the baby and it increases the breast milk output also. So always encourage mother to do skin-to-skin contact. Support mothers to initiate and maintain breastfeeding and manage common difficulties. So whatever the difficulties we have seen, if it comes, it's a very routine thing to manage it. Do not provide breastfed newborns any food or fluids other than breast milk. So by up to 6 months, only exclusive breastfeeding, nothing else except if medicine prescribed by the doctors. Enable mothers and their infants to remain together and practice rooming in 24 hours. Supports mother to recognize and respond to their infants' cues for feeding. So this is very important that if baby is hungry or not, or if baby is very hungry or started shouting and throwing hands and legs, then it is very, very important. So when the baby started showing cues, small things like moving hands and then after sleep, moving from here to here, then mother identifies the baby is about to hungry and need to give the feeding. Counseling mothers on the use and risk of feeding bottles and teats and pacifiers, and coordinate discharge so that parents and their families have time, so they have timely access to ongoing support and care. So these are 10 successful steps of breastfeeding, which should be like written and okay. Then there are the government of India has started on the comprehensive lactational management centers, lactation management units, and lactation support units. So comprehensive lactation management units are the like the breast milk banks. So they usually the medical colleges with an ICU they have, and the district hospital also have. So it has all the facilities where the milk pasteurization can be done. Milk can be expressed and stored at minus 20 degree for at least 3 months. And if required, milk can be given to other baby. Milk of one mother can be given to the other baby after pasteurization, but definitely with written consent. Lactation management units are at district hospital or large SNCUs or functional SNCUs, where they don't have the facility for the pasteurization, but mother's milk can be stored for her own baby. Like if the baby is preterm or sick, if the mother is not allowed to give the breastfeeding, allowed to give the express breast milk during that time, she can come to the LMU, she can express her milk and store them at minus 20 degree. And whenever the baby is ready to take the feed, the mother's own milk can be given to the lactation can be established with the mother's own milk. And there are lactation support units where all delivery points. So there are counselors who will visit the mother and allow like do the counseling about the breastfeeding and the positioning and attachment and many other things. So these are comprehensive lactation management unit, and the lactation support units. Then there are few contraindication for the breastfeeding. So it's not given in your FPNC book, but I'm telling you. So usually there is no absolute contraindication. Like HIV is also not an absolute contraindication because we always give them a choice to either to go for the complete breastfeeding or the complete top milk, or cancer chemotherapy, or mother is on the some radiation treatment. For that duration of treatment, she can't be allowed. If she has some active varicella chickenpox lesions on the breast or active herpetic lesion on the breast, then she'll not be allowed. She's not allowed to give for till that active lesions are there. But otherwise, after the treatment is over, then she can continue with. And if the mother is having miliary tuberculosis, so start on the treatment for at least 2 weeks, and after 2 weeks of treatment she can start on the feeding. If baby is having galactosemia is one condition where baby cannot tolerate lactose because of the some enzyme deficiencies. So then that time you cannot start on the breast milk. And some inborn errors of metabolism where some different type of feed should be given than the lactose or the galactose. So in that condition also you cannot give the milk, express milk. These are the different positioning by which mother can feed their baby. So this cradle hold is very common. Cross cradle hold is also very common. Lead back also she can do. Dangle feeding also in the lying down position she can do. With twins she can do football hold or twin sideline position also. Lying down with twins also they can feed, and football hold with single baby also she can do. So there are so many positioning of this. The most commonly we see is the cradle hold, and we can advise mother about the breastfeeding in any position. Okay, so this is all about the basics of the breastfeeding. The only important thing here is the counseling part, which we need to do repeatedly to tell mothers why it is important, because still our breastfeeding rates, exclusive breastfeeding rates are very, very less. And we know that how important the breast milk is for a baby is, because it protects her or him from lot of infections and lot of diseases. So thank you so much. And I want to thank NNF India, Dr. Sushma Nangia Madam, Dr. Surinder Bish, Dr. Pratima, for giving me this opportunity to speak today in front of you. Thank you so much.
Thank you so much, ma'am, for this informative talk.
Thank you. So, is there any questions or
No, ma'am, we haven't received any questions yet.
yeah? So, can we close now? Or if they want
Okay,
to
ma'am.
ask them, if they want to ask some questions.
You can take some time, ma'am. Like we can wait for a few more minutes.
Okay.
Ma'am, in that meanwhile, if we receive any question, I will be posting this in the chat box.
Right.
Yes, ma'am, we have received two questions. I'm posting that on the chat box.
Okay. So, what is this question? Is mixed feeding not allowed in HIV, especially in low income community? Yeah, mixed feeding is not allowed. Either you can tell them about the, because mixed feeding causes more problem to the baby. So sometimes if they are giving top milk, and it might lead to diarrhea, and then there are mucosal erosions, which if you give breast milk, then it further causes the absorption of the virus from the eroded or mucosa of the GI. So mixed feeding is not allowed in any HIV positive mother. Yeah, so same question, why alternating breast milk? I have just answered, because if you give breast milk, top milk, and then because top milk causes a lot of diarrhea, and diarrhea then leads to the mucosal damage of the gastrointestinal GI tract. And then when you give the breast milk, the absorption of the breast milk through the absorption of the viruses through the eroded gastric mucosa will occur more, and that causes more viremia in the body. So it is not indicated.
Ma'am, we have received one more question.
Yeah. So football positioning is that you can simultaneously breastfeed both the babies. So I'll show you. This is the football position where the both babies simultaneously, mother is feeding from both the breast, and she's taking, so that head end is towards the like breast of the both the babies, and legs are on the, and she's holding the head of the baby through her hand. So this is a football position for the twin babies, where she can feed her both the babies simultaneously through the uh, both the breast.
No, ma'am, we haven't received any more questions.
Okay. So can we stop now?
Yes, ma'am, if you allow me, then we can wind up.
Yeah, I think we can do it.
Thank you so
Yeah,
much,
no
ma'am,
more
and thank you.
questions.
Sorry,
Yeah.
ma'am.
If there are no more questions, we can stop it.
No, ma'am. Still not any more question. So, ma'am, with all your permission, I would like to conclude the session over here and looking forward to host you again. And good night, ma'am.
Good night. Thank you so much. Good night.
Thank you, ma'am.
Thank you so much. Good night, everyone. Thank you. Bye bye.